Health activist Dr Kgosi Letlape joins us now via video link just to weigh in on this particular report. Dr. Letlape, thank you so much for your time and thank you so much for joining us on the show. So, according to the findings that were just released this afternoon, a number of them were unsubstantiated, but the report did find, however, a number of systemic issues relating to, amongst others, infrastructure challenges. And of concern, of course, the report also speaks to issues relating to leadership, affecting governance-related and even financial-related issues. Let's get then your sense from you about what stood out from the report that further speaks to challenges facing South Africa's healthcare system.
Yeah, I think the things that are highlighted by the report are the things that need to be fixed. Before we even talk about national this, national that, if you come up with a pot of money and you haven't sorted out the structural problems in the system, it's just a waste of time and it's just a waste of money. And all the things that have been raised by the Ombud are true and they need to be fixed. Now, part of the problem of lack of SOPs is that you don't expect every institution to have its own SOP on common matters. And if we need to sort this problem out, health must be made a national competence. So we can ask the Minister of Health to account for the vacancies. But when the minister now has to resort to the MEC and provincial health, there's transference of responsibility and no accountability in the whole system. The issues that are being raised are genuine. The issues that are being raised are urgent. You have insufficient staff, and at the same time, you are not employing young professionals that are coming out that would alleviate the challenges that you have, that were trained precisely to come and alleviate our human resources problem. So what the Minister of Health needs to concentrate on is to fix the public healthcare system. The way it needs to work, it needs to work on a unitary plan. Insourcing. Food had always been provided by the hospital. Laundry had always been done inside the hospital. You go to other rural hospitals where they still need laundry and they fix their laundries, they have sufficient linen. You come to the urban environment, you come to Gauteng, this outsourcing is a cause of problems because outside providers are not paid, they withdraw services and the whole services collapse. So we need urgent steps to fix our public healthcare system. All these things that are being said are not new. When you listen to the report of the current Ombud, you go back to the report of the previous Ombud on Rahima Musa, which is a few kilometers away from Helen Joseph. It's the same issues that are being raised.
Yeah. And I mean, just, for the benefit of our viewers, of course, this report received just a few hours ago is a 59-page report. I want to draw the attention then to you on, subclauses 4.5 and 4.7 of the report, which speaks to the finance and the supply chain management as well as governance challenges. I mean, it does look like these are challenges that are across the board. 4.5 reads finance and supply management. For example, the investigation established that there was no clear segregation of duties. In the unit, due to staff shortages, there is no supervisor responsible for managing stock in the stockroom, as the same people receiving stock are also managing the stock, which creates a risk. Then there's 4.7, which speaks to governance challenges. The investigation found a lack of governance at the hospital as staff did not follow protocol when performing functions, or there were no protocols to direct practice. In 5 wards and support service departments where the walkabouts were conducted, there was no SOPs. SOPs had passed their review date and there were no SOPs at all, standard operation procedures, I would imagine. I mean, just speaking to that and listening to that, as you also say, one would think that this is probably the standard across many of our healthcare services, particularly in the public sector.
You need a unitary system. Just let me give you this example. If you had a franchise like McDonald's or Nando's, having every shop doing as it pleases, the system would not work. And no shop has to create its own accounting system, its own procurement system, because we're working from the same playbook. Now, if you have a playbook, you'd also ensure that you employ people that have the right competences to ensure that the playbook is implemented. That's simply what needs to be done. You can't have actors all over the place. You need to introduce line budgeting, where from the budget of a hospital, we know how much goes to security, how much goes to maintenance, how much goes to human resources, how much goes to equipment, how much goes to drugs. If we can't do that, the problems will just become compounded. So we need to go back to the future. We had a public healthcare system that was far better than the private system in the past, because systems were in place and you didn't have anybody. You just needed people on site to implement in accordance with the system. Yeah. And you were able to judge their performance based on the template that everyone has been given.
Yeah, I mean, the report does also, of course, point out key highlights in its conclusion and also gives recommendations. I mean, one of the remarks on the conclusion is that as a tertiary hospital, this is inadequately resourced and thus not fit for purpose. So as the country gears up for the implementation of the NHI Act, I mean, how concerning then is it when you look at this report? And as you also say, one would imagine that given budget constraints and cuts, this does represent to some degree the state of hospitals in this country. Should we then be not looking at focusing on some of these recommendations in as far as the NHI fitness is concerned?
I think maybe we need to come up with a new slogan that says there can be no NHI without a well-functioning public healthcare system, so that those that are charged with responsibility for healthcare can primarily focus on fixing our public healthcare system, and at the same time fixing the private healthcare system, which is also under the jurisdiction of the Minister of Health. Make health a national competence. Go back to basics and fix the basic thing. Make the public healthcare system work. You know, this issue about NHI this, NHI that, it's gaslighting. If you can't fix the basic problems that are highlighted by this report and previous reports and what we all know as we send our relatives to the public healthcare system or as we engage with the public healthcare system, this pie in the sky NHI is not going to happen. It detracts us from holding people accountable for a healthcare system that works. Yep. And we need either to get the president to appoint a minister of health that will focus on these issues and create the ministry of NHI that can talk about the pipe dream, whilst the practicalities of delivering healthcare are not being met. Health is in crisis, and we need urgent attention to fixing the public healthcare system.
Dr. Letlape, thank you so much for your time. As always, a pleasure to have you on the show. Health activist Dr. Kgosi Letlape there, just commenting on the latest documentation and report then by the Health Ombud on the Helen Joseph Hospital.